Acquired heart diseases. Types of acquired heart diseases include hypertrophic cardiomyopathy, dilated cardiomyopathy, myocarditis, endocarditis, Kawasaki disease, pericarditis, rheumatic fever. Hypertrophic cardiomyopathy, it means the thickened heart muscles. Hypertrophic cardiomyopathy (HCM) is a disease in which the muscle of the lower left chamber of the heart, the left ventricle, becomes abnormally thick and enlarged. Hypertrophic cardiomyopathy is a significant cause of death, and it is a significant cause of both heart failure and sudden cardiac death. It is the most common cause of sudden cardiac death among athletes also. Causes can be congenital and acquired. Congenital by born, acquired means in the lifetime we acquire. And congenital, infant born from diabetic mother, and a child born with metabolic disorder like Pompe's disease. In the acquired case, uncontrolled and a severe hypertension and a valvular stenosis. Difference with athlete's heart. Thickening of the wall in athlete's heart is symmetrical, while in the hypertrophic cardiomyopathy it is not like that. Athlete's heart may come in normal size when the vigorous exercise is stopped, but in the hypertrophic cardiomyopathy it is not possible spontaneously. It needs surgical interventions. Symptoms of the hypertrophic cardiomyopathy. If the blood flow is obstructed due to the thickened heart muscle, a number of symptoms may result, which includes shortness of the breath during physical activity, fainting, also called syncope with activities, dizziness, chest pain, also called angina, which is caused by a reduced supply of the blood to the heart, abnormal heart rhythms, which in some cases can lead to sudden death unless the heart is electrically shocked to restart a normal rhythm, heart murmur, a wheezing sound that your doctor may auscultate. Complications can be heart failure, cardiac arrhythmias, and sudden death. Management of the hypertrophic cardiomyopathy includes medical and surgical therapy to reduce ventricular contractility or increased ventricular volume, increased ventricular compliance, and outflow tract dimensions. And in the case of obstructive hypertrophic cardiomyopathy, reduce the pressure gradient across the left ventricle outflow tract. Paramount to any therapy is reduction in the risk of sudden death by identification of these patients early on and effective medical and or surgical implantation of an automatic defibrillator. Medications include beta blockers, calcium channel blockers, and rarely diltiazem, amiodarone, and disopyramide. Antitussive may be administered as needed to avoid coughing.